Well, I think that's it. I think that's it for me, and I'll field some questions after.
I'll go next. My name is Carol Lutchman, and as Karen mentioned, I'm a counseling psychologist. I did a 4-year bachelor degree program in psychology in the U.S., followed by, as I mentioned earlier, a 3-year terminal degree program, master's program in counseling psychology, which meant that I did 2 years of coursework followed by a full year of internship. And the idea of that program was to get you out in the field as a counseling therapist, very well trained, particularly to do therapy. So having come back to Trinidad, basically that's what I do. I have a private practice in St. James for the last, can't even remember how many years. My client base, basically, I see adults and from a wide range of issues, from anxiety to depression to couples therapy to trauma counseling, which is one of my specialties. I've been trained since graduating in a lot of different techniques to deal with trauma. And for those who are continuing to go out there, trauma is a specialty field that requires special techniques, assessment, and training to be able to effectively deal with trauma, because trauma counseling is more than just talking. And I'm just going to call some initials out there. You can do the research. There's stuff called EMDR, which in the last 10 to 15 years has become probably the most recognized technique for trauma counseling. There's something recently called progressive counting that has come out. There's another technique called EFT, which is emotional freedom therapy. There's also exposure therapy. All of these are specific techniques used to deal with trauma situations. And they do require specialty training to be able to use it with clients, because you have to really assess and know what's going on when you're dealing with trauma. And again, that's post your clinical counseling training, therapy training, you get the specialty training. In connection with that, having done that and come back, when was it, Grenada with Hurricane Ivan. I went with a team to Grenada after Hurricane Ivan. The team as well went to Guyana after the Guyana massacre, however many years ago. Yeah. And the idea is that when there's a major disaster, again, you can go in. There's a lot of assessment that needs to take place about who, what, when, where. And again, the trauma counseling is only one component of doing disaster work, by the way, because a lot of it is assessment and knowledge and knowing, being able to do some kind of triage about who's minimally affected, who's somewhat affected, who's badly affected, whether you need counseling intervention, psychiatric intervention. But that's part of the work I do with some of my colleagues here in Trinidad in terms of trauma. Okay? A lot of the work I do is basically couples counseling, which is also another specialty area, which I find fascinating, but many people don't, because couples dynamics interest me and amuse me. My general approach to counseling, by the way, is I'm a psychic detective, so I'm basically kind of finding out. And you have to kind of go in the framework that you don't know anything and you're just kind of finding out. Because if you think you know, you make a mistake. Just on that note, I remember a professor of mine once said, you cannot get into this field if you don't have a high tolerance for ambiguity. So you better have a high tolerance for ambiguity going in there, because you don't know a lot. Again, I do couples counseling and trauma work as a specialty area. My client base is private practice through referrals, but also I am a provider for a couple of corporations. So there are many corporations in Trinidad, which is interesting. In the last 10 years have developed EAP programs, employee assistance programs, and they refer clients. They have selected providers that they send clients, their staff to. This may be, you should also know there's a difference between what we call brief therapy versus long-term therapy. Most corporations only pay 4, 5, or 6 sessions for the most. So you have to know some kind of what we call brief therapy in order to be able to work effectively with people only 4 or 5 or 6 sessions for the most. There are people who come, you need to be able to assess for longer term work, and what to do with clients like that is a different ballgame as well. And then you have the conundrum of having people coming to you for short-term brief work, and you know they need long-term work, and what do you do with them? What else? In terms of application out there, you've got to have the clinical training to be able to do the counseling work, which I hopefully strongly recommend. But at the bachelor's level as well as the master's level, of course, there's the applied side of it, which is to go into HR work, you can go into training work, you can go into working with NGOs at the administrative policy level, administrative level. So there's a lot to be done on the application side, depending on what your interest is. Again, it's a wide field, it has a lot of application. Marketing as well is another area where there's a lot of application for psychology that's a specialty, which is fascinating about how the commercials and the ads manipulate people. And my personal pet project in recent times is the field of neuropsychology, and there's a lot, the pioneering field out there is doing brain scans and being able to see how the brain works under stress and under certain diagnostic conditions. And the computer scans, they're called fMRI, which is functional MRI machines. They do wonderful diagnostic work in terms of being able to pinpoint where the non-functional areas and the over-functioning areas of the brain are. And in my next life, that's what I'm going to do, because I think it's pioneering. It's going to be the foundation of diagnosis. And for anybody who's going out there, if at all it interests you, it's a fascinating field and it's in the pioneering stages. And we don't really do that in Trinidad, unfortunately. Okay, so that's my 2 cents.